Hey everyone, in this video we're going to go through the instructions for home whitening. Home whitening is a safe and effective way to whiten your teeth and can generally be used by most people who don't have any active disease or any fillings on their front teeth. You always need to have your mouth and teeth looked at by a dental professional to make sure that you are suitable and that the appropriate custom trays can be made. All patients are required to have a full recent examination of their teeth prior to having any whitening done. At the first appointment, your dentist or dental hygienist will screen your teeth for suitability and will take a mold of your top and bottom teeth to make some custom whitening trays for you to use. At the insert appointment, we generally go through all of this information with you. However, this is just to make sure that people have access to it when they're not in the clinic. Before inserting the trays, it is important to make sure that all the teeth are kept nice and clean, brushing and flossing the teeth before using everything. If you have sensitive teeth, brushing with sensitive toothpaste can lessen the sensitivity from the whitening. You remove the cap from the whitening gels and you place a small rice grain amount into the front portion of each of the front teeth. Putting more gel in will not generally make things work better. Put the tray in the mouth and gently press it into place and wipe off any excess with a tissue, your finger or some toothbrush. Leave the trays in undisturbed for the required amount of time. If you have the 10% gel, you generally wear them for 6 to 8 hours. If you have the stronger 16% gel, you generally wear them for about 4 to 6 hours a day. Most people wear the trays overnight while they're sleeping. Wearing the trays for longer will not harm the teeth as the gel stops working after the maximum use time. Once you're done with the whitening, remove the trays, rinse the mouth to remove the excess gel. You can brush your teeth, you can use sensitive toothpaste again at this point if you need to, just to help with any sensitivity. Clean the trays out with just some cold soapy water and keep them back in their carry cases away from children and small animals. It normally takes about 1 to 2 weeks for people to start seeing a result. As whitening is a dental procedure, it should be done with and through your dental professional. As with any procedure, there are side effects that can happen. These are generally quite minor and generally resolve on their own by stopping the treatment, but it's still important to be aware of them. The main side effect is sensitivity or discomfort during the whitening procedure. Some minor discomfort is expected. However, if it lingers or it just stays or becomes too bad, stop using and contact us. The main side effect is sensitivity or discomfort during the procedure. Some minor sensitivity is expected. However, if it lingers or becomes severe, just please let us know and we can take some steps into helping address this. Any excess whitening gel that is left on the gums can cause minor burns and the whitening should be stopped and we should be consulted just to make sure that nothing's going wrong. Generally, anything that stains a white top will stain your teeth over time, so things like tea, coffee, cigarettes, smoking, curries, red wine, all those kind of things will stain teeth over time, so if you can avoid those things while you're whitening, it will make it that much easier for everything to whiten up. We generally advise people top up after they've gotten to the colour that they want. Generally maybe once a week to once every couple of weeks or a couple of months, depending on how often you're having those sort of darker coloured foods, liquids and smoking and that kind of stuff. Thanks for watching. If you found this video helpful or know of anyone who would benefit from this, feel free to like and share this video with them. Thanks.